There's a lot of information, it's new stuff, there's a lot of controversy, there's a lot of misconceptions, there's a lot of, as you might guess, nonsense. But at the end of the day, this is probably one of the singular most important things to happen to medicine in the time that I've been doing medicine. What is a stem cell? Why are they even important in regenerative medicine? Let me give you the example that I give to a lot of my patients when I see them. Let's say that you walk out of our office here and you fall in my driveway and skidding the living daylights out of your knee. It's bleeding, it's ugly, it's got stuff in it, and that goes on for 3 or 4 days. And eventually, in 5 or 7 days, a little scab forms, still sore. In about 2 weeks, the scab starts to peel off. It's still red, a little uncomfortable. 3 weeks goes by, and you can't tell you fell. What happened there? Well, what happened is your body is trying to heal itself. Whenever there's a trauma, whether it's surgical or whether it's an accident or whether it's a worn out body parts, or even things like Parkinson's or neurodegenerative diseases, wherever there's an abnormality in the body, this represents inflammation, an inflammatory process. This becomes like a magnet. Your own body has stem cells, cytokines, and growth factors. That's part of what's floating around in your serum. And whenever there's an inflammatory process, like you just scraped your knee, those stem cells, cytokines, and growth factors, they are called into that. They become the ball bearings. They get in there and they clean up all the mess, they take away the debris, and they heal stuff. And that's how people heal, whether it's from a surgery or an accident. Now, humans aren't at the point where, like the starfish, where you can cut off a leg and it'll regrow. But we've got a lot of regenerative capabilities that people didn't realize until the advent of stem cells and exosomes, which are part of the stem cell family. The blood or the fat is harvested, it's processed, oftentimes it's an office procedure, and then re-injected into places. And that has some value. But depending on how old you are, if you're 50 or 60, now you're getting 50 or 60-year-old stem cells. And that's good, that's helpful, they're concentrated. But the fetal stem cells are the next level. And here's how this works. You find a woman who's pregnant, test her extensively for any type of infection or healthcare issues, and then she must go to C-section because the harvesting of stem cells has to be done in a sterile fashion. At C-section, the baby's born, and the fetal components that the stem cells are in are then harvested and after the baby's born, from the placenta tissues primarily. Everything is tested, and in many cases they are then frozen for use at a later date. And then they're delivered to the physician or to the clinic. The stem cells have an interesting capability too, and they are considered to be omnipotent. What does that mean? Well, that means if you take a duck egg and you stick it under some puppies that are just born, when the duck egg hatches, it's going to think it's a puppy. And in a way, the fetal stem cells, the early fetal stem cells, are somewhat like that. If you place them next to heart tissue, they're going to think they're a heart. If you put them in a joint, they're going to think they're cartilage tissue, and and if that cartilage tissue is in trouble or the heart is in trouble, it will take on the characteristics of that which it is exposed to, and the idea is to heal that component. And that's generally how it's felt for these to work. Now, that's a very sort of simplistic way of looking at that, but I think it helps people understand and not be afraid that they are something spooky, something science fiction, because they have been around for a very, very long time. This is not new technology. While they may not be FDA approved, there are many states now that are using them legally as well, and most of the states are falling into line to be able to use these amazing products for the healing process. The exosomes are the next level beyond that. The exosomes are part of the stem cell family, but they are acellular. There are no cells in them. The exosomes are for like the soup that the stem cells are floating in that initiate all the healing process that the stem cells have to encounter. I believe that the exosomes are an amazing part of the regenerative family, and those are some things that I personally like using those myself for a variety of medical conditions. The purpose of today's talk is not to talk anybody into anything, but just to educate you as to what are stem cells. But this is really important. Almost any clinic or physician can buy them. And you want to be careful, because just because someone has them doesn't mean they know what they're doing or know how to use them well or properly. So as anything else, please, please, please make sure that you trust the provider, not just because of the advertising, but you know and you trust the provider where you're getting these treatments. It is imperative.